Okay, by treating the horse leg, we can still place the return electrode on the back, because it's very easy to put it there and it's out of the way when you sit working and you're not in the way with the legs on the horse. But first, before we place it there, we have to water the coat on the fur, because to get good connection. So we wetten it, hopefully with some warm water. The horse accepts that a little bit better than the cold water. Just moisten it and wetten it enough, and after that we're gonna add some conductive cream to get the optimal connection. So we use this Skanlab cream or Vet cream, because it's made for this machine and this kind of treatment, so we get the optimal electric field through the horse to be able to get the treatment going on the leg. So I add enough cream. Massage it down a little bit in the coat, and after doing that we're gonna go down to the leg and prepare the leg as well before we attach the electrode. Okay, then attaching the return electrode, we use a rubber band and put it around the body of the horse in the moist, and then we have this knot which make it easy to tighten the band to get optimal connection. And I put the knot where I'm expecting to have the return electrode, because that gives some extra pressure on the return electrode if it's underneath the knot. Just have to find the band here behind. This is almost like pulling the saddle. He was a little bit thicker than I thought, so we just have to move this, and that's the easy why we have so many holes. We can move this around a lot and use it wherever it's needed. Then we should be good. And I tighten it firm, but not like he's stopped breathing. And I can tighten it even a little bit more. And I do that after putting the return electrode underneath. Alright, now we're going to look into what we call a check ligament. Check ligament is an issue and an injury coming up mostly due to overload by too much training, too hard training, too soft ground over long term. This is a problem that is common by several horses, but also combined with the deep flexor tendon partie. And it's a problem that to diagnose it is beneficial to have ultrasound scanning to be sure what it is. Let the veterinarian do that first. And next to that is that seen that the horse is lame. You get a pretty acute lameness if there's a big injury. If it's a small injury, the lameness can be less big. But with dialogue with an equitherapist or a veterinarian, you should be able to diagnose this pretty well. Prognosis is not too bad for this problem, but by using the Vet or the Skanlab vet, you will probably decrease the rehabilitation time with more or less 50%. Starting treatment, we pinch on-off button, we see the green light on the treatment head, and then we start with the treatment. Nice circular movements on the lateral side and also as well on the medial side. Here you can do two choices. You can use the half of the treatment time on the inside, on the medial side, and half of the treatment time on the outside. I try to work it back and forth as good as possible. I feel comfortable with that. But there's nothing wrong by doing half time on the inside and half time on the outside. So that's your choice whether you would like to do it in one way or another. If the horses start to get moving back and forth, of course, then we pinch the minus button to go down one step. The parameter set in the machine is the maximum level you're going to treat on. And now he's anxious. I just think he rebalanced himself. I don't worry because he moved his leg a little bit, but it was only a question of rebalancing. If this was a subacute issue, you should be treating him every day for the 5 to 6 first day, and the second week every second day, and the third week every third day. And after somewhere between 10 and 15 treatments, it should be nice if you have a new veterinarian scanning of the ultrasound scanning of the tendon and check ligament and see if the swelling has gone down, it start to kind of heal the tissue again, which tells you that you are ready for the next step to start rehabilitation activity on a very, very low level in the start. But it will probably decrease the treatment time with 50%. And meaning that you will be quicker back in the show pen or in the competition arena or in the trot arena or just having a nice healthy horse. After treatment is very necessary and very nice to use water again and sponge to get rid of the cream as good as possible and dry the coat as much as possible, because that makes the tissue and the skin kind of nicer for the skin, that you don't get too much moisty cream stick there for a long time. And you rub it with a towel or paper just to dry the area to get the rest of the cream and the water out of the tissue. Sometimes it can be beneficial to bandage the horse after treatment to keep the heat there for a while longer after treatment, but not more than half an hour to 45 minutes. And sometimes if it's very swollen, it could be smart and necessary to keep a pressure bandage on them to decrease that the swelling kind of expand and kind of destroy more tissue. And that's especially in the first acute phase.